Afternoon, ladies and gentlemen. On behalf of Shalby Hospital Mohali, we extend a very warm welcome to all our dignitaries, eminent doctors, esteemed media partners, corporate guests, and everyone gathered here today for a landmark occasion launch of Advanced Gastro-Sciences Department, expanding access to specialized digestive care. Before we begin, it is our privilege to acknowledge our distinguished guest, Dr. Charanjit Singh, Honorable MLA Chamkaur Sahib, who graced the occasion as the chief guest, and he has a very humble and gentle nature. He is known not only in the area but also in the whole of Punjab as a prominent social worker, where he used after retiring from the PGI, he has run a hospital, Shubh Karan Bhatti Specialist Hospital in Morinda, where he used to serve the people for a very small fee or even for free of cost. So we are deeply honored to have your presence as we unveil an innovation that will benefit countless patients in Punjab and beyond. So, to commence this ceremony with blessing and positivity, may I invite our dignitaries on stage for the traditional lamp lighting. Dr. Charanjit Singh, Dr. G.R. Verma, Dr. Pankaj Bhalla sir, Dr. Ravinder Goyal, Dr. Rahul Gupta, and Mr. Gladwin Sandeep sir. सर मैं आपके साथ सर आप चलाओ मैं आपके साथ thank you everyone for gracing this moment and lighting the path to a new era in patient care. So today, Shalby Hospital Mohali launches this department which enable us to manage complex gastrointestinal and condition with a multidisciplinary approach, combining surgical expertise like gastrosurgeon, gastroenterologist, interventional radiology, and oncologist and oncosurgeon with advanced technology for optimal patient outcomes. Let us now hear from the leader who has been instrumental in bringing this advancement to our patients. May I invite Dr. G.R. Verma, Senior Consultant, GI and Laparoscopic Surgery, to address this gathering. Can we have Dr. G.R. Verma?
Well, honorable dignitaries on the dais, thank you so much, Dr. Charanjit Singh, for accepting our invitation to grace this occasion. I really was thinking this occasion for quite some time, and have requested our Mr. Gladwin to organize the event because we, as the Department of the Gastroenterology, were engaged actually in all kinds of advanced gastroenterological diagnostic and therapeutic procedures, as well as the all kinds of advanced surgeries being undertaken for the last 2 years, ever since we have joined. So we were really looking forward for this occasion to formally being inaugurated as a facility in this hospital, so as to to disseminate this information to the rest of the tri-cities, that all kinds of advanced services, open surgery and the advanced laparoscopic surgery, they are available under one shade, and that is the Shalby Hospital Mohali. Friends, I think I'll not go into too much of details because I think lot many friends are about to speak. But I will only say that this occasion was primarily meant to disseminate. Number one, we just wanted to tell you that the gastrointestinal system, as we all know, it's a cluster of multiple organs which are primarily involved in the digestion of the food, absorption of the important nutrients, and the excretion of the waste product from the body. Indirectly, actually, it plays a role of overall health in maintaining the, the overall health in the body and to provide the essential nutrient and the energy for the rest of the body to function. So indirectly, you can say it's a powerhouse of the body. It does provide the energy constantly so that all organs functions in a normal way. Gastrointestinal system actually is communicated with our brain by way of millions of neurons, hormones, and multiple billions of the bacteria in our gastrointestinal tract. Therefore, any change in our mental status, and even whether it may be a something is reflected of the gastrointestinal symptom, mostly by way of it may be a crampy abdominal pain, you may faint, sometimes you may experience an unusual borborygmy, abdominal distension, pain in abdomen, crampy abdominal pain, and when it is extreme, it can lead to sometimes even diarrhea and constipation. Majority of the gastrointestinal disease are functional in origin, and they may be because of your subconscious mind is feeling some kind of stress or depression, and it is reflected by way of the gastrointestinal diseases. Therefore, when these kind of symptoms they are not counseled in the beginning, they ultimately lead to diseases like the irritable bowel syndrome, what we call IBS, we are GERD, the gastro I mean the esophageal, the reflux disease, irritable bowel syndrome, inflammatory bowel disease, etc. Besides that, there are multiple gastrointestinal disease like the gastrointestinal, the gallstones, and even the gastrointestinal tumor are being detected quite frequently nowadays with the advent of all advanced endoscopic procedures. Since the change of the lifestyle and the primarily the food habits and the sedentary lifestyle has brought a number of changes in our body system, and it is really responsible a plenty of our gastrointestinal symptoms actually. Apart from these diseases are also responsible for creating a situation where the body does not react at a subconscious level or even a painless level to lead on to the chronic inflammation, but ultimately sometimes can even lead to the tumors. Gastrointestinal tumor accounts for nearly 20% of all the tumors in the body. And in majority of these cases, especially the colon, the stomach, and the esophageal, the best is the risk factors, which is known in almost all the cases, is either the tobacco, is the smoking, high fried food, red meat. And it is because of the change in the diet in the preceding, I would say, 30, 40 years that the incidence of gastrointestinal cancer have risen exponentially. Now, luckily, with the advent of diagnostic, the investigation with the gastroenterology colleagues, many of the diseases can be diagnosed in the beginning if the patients are counseled that any symptoms of you, if it persists beyond 4 weeks after a treatment with your local practitioner, please do consult your specialist so that these diseases can be detected in the earlier stages. Shalby Multi-Speciality Hospital is proudly actually is announcing that it is a center of excellence for the gastro-sciences, and this gastro-science center is being they looked after by all our dedicated team of the gastroenterologist, GI surgeon, intervention radiologist, and the oncologist. And as a matter of fact, all the consultants they are working either independently or with collaboration, depending on the time of the cases, and they do discuss the cases among themselves so as to bring out the best treatment outcome patient can get. This is the purpose of a multi-specialty, the specialty. They work in cohesion and coordination in the interest of the patient and to deliver the best treatment which is required in a given situation. Now, our experienced gastroenterologist, Dr. Rahul Gupta, I know he's quite experienced and he is doing a lot of procedures which are, in the diagnostic as well as therapeutic endoscopy procedure. Of late, I think he has done a very important, the capsule endoscopy is one of the very advanced kind of the diagnostic procedure which is performed rarely in cases of the GI, the bleeding of unknown origin. Similarly, another Dr. Ravinder Goel, I think he is also done, I think the last month only, he has successfully performed a metal stenting in a difficult case of carcinoma, advanced case of carcinoma gallbladder, and the patient went home successfully. So we can vouch for the experience and the competence of all the people are concerned. GI surgeon, the third, I'm also looking after the GI surgery along with Dr. Balla. We have got a reasonable experience of nearly 4.5 decades of surgical experience in gastrointestinal surgery, and make sure that the patient gets the best treatment in this hospital. At the end, I would say, since the gastrointestinal disease, many of them, they have the preventable causes like the poor, the diet, especially the nowadays the fast food, the processed food, the red meat, alcohol, tobacco. I think these are the known risk factors of various gastrointestinal diseases. Therefore, if you really want to give a happy and healthy life, please avoid these kinds of the food, or instead I would encourage the people to use most of the fresh fruit and vegetables, have the lot of the salad, and have the whole meat, the like a whole grain diet like a dalia, the khichdi, and all kinds of the sprouts, the upma, and the lots of green vegetables. I think if you really stick to this kind of food habits and avoid all those foods which are the risk factors of creating many problems, I think you can live a happy and healthy life. Thank you very much.
Thank you, sir. Now I invite Dr. Ravinder Goel, sir, on the stage. Thank you, sir. Thank you.
Thank you, Dr. Ankita. Good afternoon, everyone. जैसा कि डॉक्टर वर्मा ने सब he has very well explained about what we do in gastroenterology. We see a lot of variety of diseases, varying from esophagus to liver to pancreas and colon and small intestine. So with the availability of good gastrosurgeons, तो हमारा जो confidence level है वो कई गुना बढ़ जाता है, and with the formation of a GASTRO-SCIENCES department, I think we will be able to do much better and give much better care to our patients. Thank you.
Thank you, sir. Thank you so much. Now I invite Dr. Rahul Gupta to share his insightful on this. Thank you, sir. Thank you so much.
Good afternoon, everybody, and thank you, sir, for taking out your time from the busy schedule. We all know that you're a very, very busy person. And thank you, Dr. Jia Verma and Vladimir, sir, for conceptualizing and taking out this concept, which we're planning for last, sir, I think 1 year, that department. So I think with the initiation of this dedicated department, the lack which we were having in this department will be well taken care of. I think we will leave no leaf unturned to do the welfare of the patient, which comes with the GI problem in our hospital. So we have already, as told by Dr. Verma, we have all the facilities available and we are well equipped to do handling all the cases of GI, whether they are medical management, demanding medical management or demanding surgical management. We are very, very well equipped, and not our gastroenterology suite, which we have, Also, our OTs are well equipped to do handle any sort of elective or emergency procedure. So I once again thank my colleagues and Gladwin sir, and thank you very much.
Thank you, Dr. Rahul. Now I invite Dr. Pankaj Bharda on the stage. Dr. Pankaj Bharda. Thank you, sir.
Good afternoon. Good afternoon, Dr. Charanjit, for your time. Good afternoon, Gladwin sir and dear Verma and whole of the team. You know, everything is explained very well by all my colleagues. But one thing is that gastroenterology is not a new gastroenterology is not a new branch. It is old one. Previously, they have pain and they took a medicine. It is basically divided into two diseases, benign or malignant. That is different from the oncosurgery. So in this hospital, by starting the gastroenterology department, we all the things that is benign diseases or surgical or medical, all will be taken care of. In our hospital, we are doing regularly all the GI surgery that is for benign diseases for malignancy. We are doing regularly, and all things are explained by everybody. Thank you very much.
Thank you, Dr. Pankaj, sir. And now the moment we have all been waiting for, the official unveiling of the Advanced Gastro-Sciences Department at Shalby Hospital, Mohali. May I request our Chief Guest of Honor, Dr. G.R. Verma, Dr. Ravinder, Dr. Rahul Gupta, Dr. Pankaj Bhalla to kindly join us for the unveiling. Thank you.
Great day today that for a pioneer institute Shalby Hospital, it is having another feather in your cap that you are going to have a gastro sciences department. So cheers to you. All the distinguished doctors on the dais, CEO Mr. Gladwin, my fellow doctors, press, and all other invitees. ਸਾਰਿਆਂ ਨੂੰ ਸਤਿ ਸ੍ਰੀ ਅਕਾਲ ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ So it's an honor for me that you have called me on this occasion because I never thought that I am on at that level that I'll be inaugurating such a big new department in your hospital. Somebody said that all the good things I did in life, nobody remembers. And all the bad things I did in my life, nobody forgets. So, but you have reversed this, and I find that it is a happy moment for me also that you have called me here. And on a subject that is very important because all the organs of the body, if your stomach, your intestines, if your digestion is proper, only then your body can run in a better way, in a good way. Otherwise, the survival is very difficult. And the GI disease is that, as Dr. Verma said, they account for around 20 to 25% of the morbidity today. And the big thing, carcinomas. Perhaps I don't know, everybody knows that every sixth death is due to CAs. And GICAs, they account for around 20 to 25% of the all the CAs. So this is a very important department, and I am very glad that Shalby is having this, and all congratulations to you. And the cause of all the GI problems, it may be peptic ulcer, irritable bowel syndrome, or inflammatory bowel diseases, or GERD, whatever, gallbladder diseases, all are due to uh, lifestyle. I may call it that these are all lifestyle diseases. As we have hypertension, as we have stroke, the same way we are having this GI disease. And it is your lifestyle in this era, because these days we are not having more infections as it was earlier. The main cause of disease today is your lifestyle, how you are handling your life, what you are eating, what is your input and what is your output. So this is my personal feeling, because I am right from 84 onwards, I am maintaining 75 as weight, as my weight. So the main cause is that I am having everything in proportion. I am having a good diet. I am also having exercise, and I travel at least by foot, say around 5 kilometers daily. And I don't remember since I passed out from PGI in 89, when I had some free time, only for family time, you can say, because I am into politics. When you are into politics, you have to give share your time, family time with the public, with the community, but still maintaining that. So, not going into a long lectures as we are used to, I, I'll simply say that you have to maintain a good lifestyle. You should know what to eat. Excess of everything is bad. एक शायर ने कहा है कि सैर कर दुनिया की गाफिल जिंदगानी फिर कहाँ, जिंदगानी कर रही तो ये जवानी फिर कहाँ. So that is the crux of a good lifestyle, and you should give ample time for your family also, which sometime I miss, because that is also going to give you stress. And the three factors, stress is one of the factors which you should avoid. Maybe it is unavoidable, because unless you have stress, you can't progress also. But a little bit of stress and a good diet, a good lifestyle, not a sedentary one, that will keep you away from doctors. But since we are into this field, this is a social field, actually, health field. You are doing a great job. So I wish you all the success in this hospital, and I hope that you will do a good and great service to the community. And as part of the government also, I'm always there. Wherever you feel that my requirement is there, I'll be with you, and always with you. Thank you very much.
Thank you, sir. Thank you. Thank you.
Good afternoon, sir. My special thanks to Dr. Charanjit, sir. Thanks for giving us the time. And I can see, sir, your fan following that everyone want to come and interact with you. This speaks a very high volume about you. I was reading about you, sir. You've done a wonderful job, not only as a doctor but as a politician also. जैसे आपने बताया सर एज ए कम्युनिटी ophthalmologist you have done a lot of the community camps in the community. Sir, thank you very much for sparing a time for us and giving us this platform to launch our GI Sciences department. In the GI, we have best doctors like Dr. J.R. Verma, Dr. Rahul Gupta, Dr. Ravinder Goyal, Dr. Pankaj Vala. These names don't need any introduction. Only the names is sufficient. And thank you very much, sir. Thank you very much for gracing the occasion and motivating us. And you already are doing a lot of good work through the Punjab government. And I must appreciate the recently what you have launched a scheme for all the Punjab resident of 10 lakh insurance scheme. That's a commendable thing. And thank you, sir. Thank you very much for taking time.
Thank you, sir. Thank you.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਦੋਸਤੋ, ਅੱਜ MLA ਚਮਕੌਰ ਸਾਹਿਬ ਤੋਂ ਚਰਨਜੀਤ ਚੰਨੀ ਜੀ ਪਹੁੰਚੇ ਖਾਸ ਸ਼ੈਲਬੀ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ, ਜਿੱਥੇ ਕਿ ਗੈਸਟਰੋ ਸਾਇੰਸ ਦਾ ਹੈ ਨਾ ਲਾਂਚਿੰਗ ਸੀ। ਸੋ ਕੀ ਕਹਿਣਾ ਚਾਹੋਗੇ? ਪਹਿਲਾਂ ਤਾਂ ਮੁਬਾਰਕਾਂ ਸ਼ੈਲਬੀ ਹਸਪੀਟਲ ਨੂੰ, ਔਰ ਤੁਹਾਡੇ ਵੱਲੋਂ ਵੀ ਜਿਹੜਾ ਅੱਜ ਲਾਂਚਿੰਗ ਕੀਤੀ ਗਈ।
ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਤਾਂ ਮੈਂ ਬਹੁਤ ਬਹੁਤ ਮੁਬਾਰਕਬਾਦ ਦਿੰਦਾ ਸ਼ੈਲਬੀ ਹਸਪੀਟਲ, ਜੋ ਕਿ ਇੱਕ ਬਹੁਤ ਹੀ ਪ੍ਰੈਸਟੀਜੀਅਸ ਇੰਸਟੀਚਿਊਟ ਹੈ ਐਂਡ ਬਹੁਤ ਸਮੇਂ ਤੋਂ, ਆਈ ਥਿੰਕ ਮੋਰ ਦੈਨ 25 years they are serving the community। ਬਹੁਤ ਅੱਛਾ ਕੰਮ ਕਰ ਰਹੇ। ਪਹਿਲੇ ਆਰਥੋ ਦੇ ਵਿੱਚ ਕਾਰਡੀਓ, ਔਰ ਹੁਣ ਜੋ ਇਹਨਾਂ ਨੇ ਜਿਹੜਾ ਗੈਸਟ੍ਰੋਐਂਟਰੋਲੋਜੀ ਦਾ ਪੂਰਾ ਡਿਪਾਰਟਮੈਂਟ ਸ਼ੁਰੂ ਕੀਤਾ ਹੈ, ਇਹ ਇੱਕ ਬਹੁਤ ਵੱਡੀ ਗੱਲ ਹੈ। ਔਰ ਕਿਉਂਕਿ ਅੱਜ ਅਗਰ ਦੇਖਿਆ ਜਾਵੇ ਤਾਂ ਗੈਸਟ੍ਰੋਐਂਟਰੋਲੋਜੀ ਦੀਆਂ ਜਿਹੜੀਆਂ ਸਾਡੀਆਂ ਮਤਲਬ ਪੇਟ ਦੀਆਂ ਤੇ ਆਂਦੜੀਆਂ ਦੀ ਪ੍ਰੋਬਲਮ ਜਿਹੜੀ ਹੈ, ਇਹ ਬਹੁਤ ਵੱਧ ਰਹੀ ਹੈ। ਔਰ ਇਹਦਾ ਕਾਰਨ ਵੀ ਇਹੀ ਹੈ ਕਿ ਸਾਡਾ ਜਿਹੜਾ ਲਾਈਫ ਸਟਾਈਲ ਹੈ ਉਹ ਅਸੀਂ ਦਿਨੋਂ ਦਿਨ ਚੇਂਜ ਹੁੰਦਾ ਜਾ ਰਿਹਾ। ਆਪਾਂ ਰੁੱਖੀ ਸੁੱਕੀ ਜਿਹੜੀ ਪਹਿਲਾਂ ਅਸੀਂ ਖਾਣ ਦੇ ਹੁੰਦੇ, ਰੁੱਖੀ ਸੁੱਕੀ ਖਾ ਕੇ ਠੰਡਾ ਪਾਣੀ ਪੀ, ਉਹ ਸਾਰਾ ਭੁੱਲ ਕੇ ਅਸੀਂ ਹੁਣ ਜੰਕ ਫੂਡ, ਹੌਟ ਫੂਡ ਤੇ ਰੈਡੀ ਫੂਡ ਉਹ ਜਿਹੜਾ ਹੈਗਾ ਅਸੀਂ ਵਧਾ ਲਿਆ। ਈਵਨ ਯੰਗਸਟਰ ਜਿਹੜੇ ਹੈਗੇ ਬੱਚੇ ਸਾਡੇ, ਉਹ ਐਲਕੋਹਲ, ਟੋਬੈਕੋ, ਇਹ ਸਾਰਾ ਕੁਝ ਸਾਡੇ ਜਿਹੜਾ ਬਿਮਾਰੀਆਂ ਵੱਧ ਰਹੀ, ਇੱਕ ਸਟ੍ਰੈਸ ਦਿਨੋਂ ਦਿਨ ਵਧੀ ਜਾ ਰਹੀ ਹੈ। ਸੋ ਵੀ ਆਰ ਗੋਇੰਗ ਅਵੇ ਫਰੋਮ ਗੋਡ ਐਂਡ ਦੈਟ ਇਜ਼ ਦਾ ਮੇਨ ਕਾਜ਼ ਦੈਟ ਵੀ ਆਰ ਹੈਵਿੰਗ ਸਟ੍ਰੈਸ। ਬਾਕੀ ਲੋਕਾਂ ਦੀਆਂ ਇੱਛਾਵਾਂ, ਆਕਾਂਖਸ਼ਾਵਾਂ ਬਹੁਤ ਵੱਧ ਗਈਆਂ, ਠੀਕ ਹੈ ਜੀ। ਸੋ ਉਹਦੇ ਕਾਰਨ ਜਿਹੜੀਆਂ ਹੈਗੀਆਂ ਪ੍ਰੋਬਲਮਸ ਆ ਰਹੀਆਂ, ਤੇ ਸ਼ੈਲਬੀ ਹਸਪੀਟਲ ਦਾ ਇਹ ਡਿਪਾਰਟਮੈਂਟ ਡਾਕਟਰ GR ਵਰਮਾ ਜੋ ਕਿ PJ ਸੀ ਮੇਰੇ ਨਾਲ, ਇਹਨਾਂ ਦੇ ਨਾਲ ਹੋਰ ਡਾਕਟਰ ਗੁਪਤਾ, ਡਾਕਟਰ ਗੋਇਲ, ਡਾਕਟਰ ਭੱਲਾ, ਦੇ ਹੈਵ ਏ ਵੈਰੀ ਗੁੱਡ ਟੀਮ। ਬਹੁਤ ਵਧੀਆ ਟੀਮ ਹੈ ਇਹਨਾਂ ਦੀ। ਸਾਰੇ ਗੈਸਟਰੋ ਐਂਟਰੋਲੋਜਿਸਟ ਐਂਡ ਗੈਸਟ੍ਰਿਕ ਸਰਜਨਸ, ਐਂਡੋਸਕੋਪੀ ਦੇ ਔਨਕੋਲੋਜਿਸਟ, ਸਾਰਾ ਵਧੀਆ ਟੀਮ ਇਹਨਾਂ ਕੋਲ ਹੈ। ਸੋ ਮੈਂ ਸਮਝਦਾ ਕਿ ਆਮ ਪਬਲਿਕ ਲਈ, ਸਾਡੇ ਪੰਜਾਬੀਆਂ ਲਈ ਇੱਕ ਬਹੁਤ ਵਧੀਆ ਜਿਹੜਾ ਇੱਕ ਪਲੇਟਫਾਰਮ ਇੱਥੇ ਸ਼ੈਲਬੀ ਹਸਪੀਟਲ ਵੱਲੋਂ ਮਿਲਿਆ। ਸੋ ਮੈਂ ਜਿੱਥੇ ਇੱਕ ਵਾਰ ਫਿਰ ਉਹਨਾਂ ਨੂੰ ਮੁਬਾਰਕਬਾਦ ਦਿੰਦਾ ਸ਼ੈਲਬੀ ਹਸਪੀਟਲ ਨੂੰ, ਉੱਥੇ ਆਸ ਕਰਦਾ ਕਿ ਇਹ ਵਧੀਆ ਸਰਵਿਸਿਜ਼ ਦੇਣਗੇ ਔਰ ਐਟ ਏ ਪ੍ਰਾਈਸ that is affordable।
ਸੋ ਪੰਜਾਬ ਸਰਕਾਰ ਵੀ ਬਹੁਤ ਜ਼ਿਆਦਾ ਉਪਰਾਲੇ ਕਰ ਰਹੀ ਹੈ ਨਾ ਸਿਹਤ ਯੋਜਨਾਵਾਂ ਨੂੰ ਲੈ ਕੇ। ਸੋ ਸ਼ੈਲਬੀ ਹਸਪੀਟਲ ਲਈ ਵੀ ਕੋਈ ਪੰਜਾਬ ਸਰਕਾਰ ਵੱਲੋਂ ਕੁਝ ਹੋ ਸਕਦਾ?
ਬਿਲਕੁਲ। ਐਜ਼ CEO ਸਾਡੇ ਡਾਕਟਰ ਮਿਸਟਰ ਗਲੈਡਮਿਨ, ਉਹਨਾਂ ਨਾਲ ਗੱਲ ਹੋਈ ਹੈ। ਦੇ ਹੈਵ ਆਲਰੇਡੀ ਗੋਇੰਗ ਟੂ ਸਾਈਨ ਏ ਐਗਰੀਮੈਂਟ ਵਿਦ ਦਾ ਗਵਰਨਮੈਂਟ। ਤੇ ਜਿੱਦਾਂ ਕਿ ਹਰ ਪਰਿਵਾਰ ਨੂੰ 10 ਲੱਖ ਦਾ ਬੀਮਾ ਜਿਹੜਾ ਸਰਕਾਰ ਦੇ ਰਹੀ ਹੈ, ਇੱਕ ਐਸਾ ਕਦਮ ਜੋ ਅੱਜ ਤੱਕ ਕਦੇ ਨਹੀਂ ਹੋਇਆ। ਲੋਕੀ ਜ਼ਿਆਦਾਤਰ ਇਹੀ ਸਮਝਦੇ ਵੀ ਆਪਣੇ ਹਾਊ ਟੂ ਇਨਕਰੀਜ਼ देयर कॉफर्स, ਕੋਈ ਸਮਾਜ ਲਈ ਕੰਮ ਕਰਨਾ ਨਹੀਂ ਚਾਹੁੰਦਾ। ਹੁਣ ਤੱਕ ਜਿੰਨੀਆਂ ਸਰਕਾਰਾਂ ਆਈਆਂ ਸਾਰੀਆਂ ਲੋਟੂ ਸਰਕਾਰਾਂ ਆਈਆਂ, ਇਹ ਪਹਿਲੀ ਸਰਕਾਰ ਹੈ ਸਰਦਾਰ ਭਗਵੰਤ ਸਿੰਘ ਮਾਨ ਉਹਨਾਂ ਦੀ, ਜੋ ਕਿ ਇੱਕ ਵਧੀਆ, ਇੱਕ ਕਹਿੰਦੇ ਨਾ ਵੀ ਅੱਛਾ ਹਿਰਦਾ ਜਿਹੜੇ ਰੱਖਦੇ ਨੇ ਔਰ ਲੋਕਾਂ ਲਈ, ਔਰ ਇਹ ਸਰਵਿਸ ਜਿਹੜੀ ਹਰ ਘਰ ਨੂੰ ਜ਼ਰੂਰੀ ਚਾਹੀਦੀ ਸੀਗੀ ਉਹ ਉਹਨਾਂ ਨੇ ਦਿੱਤੀ ਹੈ। ਸੋ ਡਾਕਟਰ ਸਰਦਾਰ ਭਗਵੰਤ ਸਿੰਘ ਮਾਨ ਉਹਨਾਂ ਦਾ ਵੀ ਬਹੁਤ ਧੰਨਵਾਦ। ਤੁਸੀਂ ਦੇਖੋਗੇ 2-4 ਹਫ਼ਤੇ 'ਚ ਹਰ ਪਰਿਵਾਰ ਨੂੰ ਜਿਹੜਾ ਇਹ ਸਰਵਿਸ ਮਿਲੇਗੀ, ਔਰ ਸ਼ੈਲਬੀ ਹਸਪੀਟਲ ਵੀ ਪਾਰਟ ਹੋਏਗਾ that team which is going to serve the Punjabis.
ਸੋ
Thank you.
ਆਵਾਮ ਜਨਤਾ ਲਈ ਕੀ ਮੈਸੇਜ ਦੇਣਾ ਚਾਹੁੰਦੇ
ਆਮ ਜਨਤਾ ਲਈ ਮੈਂ ਇਹੀ ਕਹਾਂਗਾ ਕਿ ਰੁੱਖੀ ਸੁੱਖੀ ਖਾ ਕੇ ਠੰਡਾ ਪਾਣੀ ਪੀ, ਠੀਕ ਹੈ ਜੀ, ਜੋ ਸਾਡੇ ਗੁਰੂਆਂ ਪੀਰਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਅਸੀਂ ਜੋ ਆਪਣਾ ਲਾਈਫ ਸਟਾਈਲ ਆ ਉਹਨੂੰ ਚੇਂਜ ਕਰੀਏ, ਆਪਣੇ ਆਪ ਨੂੰ, ਆਪਣੇ ਮਨ ਨੂੰ ਸ਼ਾਂਤ ਰੱਖੀਏ, ਖਾਣਾ ਪੀਣਾ ਸਹੀ ਕਰੀਏ, ਨਸ਼ਿਆਂ ਤੋਂ ਦੂਰ ਰਹੀਏ, ਠੀਕ ਹੈ ਜੀ। ਔਰ ਕਿਉਂਕਿ ਨਸ਼ੇ ਜਿਹੜੇ ਆ ਇਹ ਇੱਕ ਬਹੁਤ ਵੱਡਾ ਕਾਰਨ ਹੈ। ਅੱਜ ਅਗਰ ਅਸੀਂ ਕੈਂਸਰ ਦੀ ਗੱਲ ਕਰੀਏ, ਜਿਸ ਬਾਰੇ ਹਰ ਬੰਦਾ ਡਰ ਜਾਂਦਾ, 95% ਜਿਹੜੇ ਕੈਂਸਰ ਹੈ ਉਹ ਜਿਹੜੇ ਲਾਈਫ ਸਟਾਈਲ ਔਰ এনवायरमेंट ਕਰਕੇ ਹੁੰਦੇ। ਅਗਰ ਅਸੀਂ ਆਪਣਾ ਲਾਈਫ ਸਟਾਈਲ ਬਦਲ ਲਈਏ ਤਾਂ ਫਿਰ ਤੁਸੀਂ ਦੇਖ ਲਓ 95% ਜਿਹੜੇ ਸਾਡੀ ਕੈਂਸਰ ਜਿਹੜਾ ਘਟ ਸਕਦਾ। ਸੋ ਇਹੀ ਮੇਰਾ ਮੈਸੇਜ ਹੈ।